I'm really honored to be here and to have been invited. Thank you for putting together such quality content and such wonderful content that is free to the public, that is available to our community of practitioners, right? Those who are in the field and to those of us who are doing research, and also to students, right? Those aspiring and those looking to us to give them some guidance and information, and also present research and findings that hopefully will be helpful. And hopefully today, by the end of today, you will take away some additional information, or maybe it'll be a good refresher if it's not new, if you have had a lot of these experiences already. So today we'll talk about simultaneous interpreting in healthcare settings. It is a topic that is minimally explored, and there's a lot of reasons which we won't be talking about today, but we can discuss after the I conclude with the main presentation that I have prepared. So thank you and welcome. Get settled in, take some notes, and hopefully if you have questions, please, I'm always open to those, and welcome conversation and engaging at the conclusion of this presentation, so we can hopefully share ideas and come up maybe with even more right questions that we can look to answer, or seek answers for as we continue our work and as we continue forward in this profession. So just to give you a bit of an overview of today's presentation, it primarily, as I said, centers on simultaneous interpreting in healthcare settings and in the US context, primarily in the US context, that is. And I'll begin first by talking about some of the background and the existing literature and research on simultaneous interpreting and how that ties into today's topic, or rather, right, how we have arrived at this topic and the research questions for which I set out to find answers. Really kind of going directly to the source, and getting right the information from, is it from the horse's mouth? I think that's the expression that we use, right? Going to the community of practice, going to the interpreters and the practitioners, right? And I also want to say thank you to those who have participated and made this research possible, because it was we had a really large number of responses that we did not anticipate. And I say we because I also wanted to express my gratitude to my colleague who participated or supported this research as well, my colleague Mark Tamarit Galdon, professor at University of Louisville, Kentucky, and who also is a co-author on this forthcoming manuscript, which will be published in the spring of 25. I know we have to wait until February, but this will be available to you, open access, free to all, once it's published. So I wanted to express my gratitude to him as well and acknowledge his contribution. Now, I will be speaking about the interpreter, how interpreters decide, right, or determine which mode or technique is best suited for a given session or interpreted event. And you will hear me talking about sessions or clinical encounters, medical encounters, or as interpreted events or interpreting sessions. And after that, I will provide a portion of the findings about the frequency of use and the nature of the encounter. And then at the conclusion, we can talk more about this in the Q&A as well, right? But we'll kind of talk a little bit about some of the future directions and perhaps opportunities for simultaneous interpreting in healthcare interpreter education and training, right? And how we can perhaps take some of the information that we have and the data that we have gathered and the findings to then help shape the education and interpreting that we currently have, right? How those modules perhaps could look like, on those educational programs, and what those might look like as we move forward in interpreter preparation and education. Now, healthcare interpreting, as we all know, those of us who or any interpreting really is a complex activity, as we know, right? But in terms of healthcare interpreting itself, we'll focus on that today, right? It is a constant decision-making process in which the interpreter makes a series of conscious and subconscious choices, right, in order to ensure effective communication between all parties in the interaction. And one of the main considerations is which mode of interpreting or which technique, right, is best supports the goals or of a given communicative event or situation, or of that particular session, right? Clinical or non-clinical. So to date, the use of simultaneous interpreting in healthcare settings has largely been supported by anecdotal evidence, right? So a lot of us have heard that it's cited in reference to emergency situations, mental health, perhaps some educational seminars, and pediatrics, right? Those are often the main categories that are cited. And despite the common misconception around the limited use of simultaneous interpreting in healthcare, this technique or mode of interpreting is employed in a much wider variety of settings, right, or clinical and non-clinical interactions. And what I hope is that by the end of today's presentation, right, or this webinar, that you'll leave with a greater understanding of simultaneous interpreting in healthcare or medical settings, right, and the frequency of simultaneous interpreting use compared to other modes of interpreting, and the nature of the encounter. Now, with the role of the interpreter itself, right, we all know that, or for those who do not know, right, the role is for the interpreter to ensure that communication is effective. And the three modes of interpreting frequently associated with this setting or with healthcare settings are consecutive, simultaneous, and cite. And the consecutive mode has been deemed the default or the standard mode for healthcare interpreters. And if you look at the California standards for healthcare interpreters, you will find this very language, right? It's the standard mode for healthcare interpreters. And this belief is shared by the community of practice, and it's addressed by several scholars, right, as pertains to healthcare communication. Which whether it takes place between language concordant participants, right, or participants who speak the same language, or whether it's done in a session where there is an interpreter who is partnering with providers and the patients to help them communicate, right, this particular, it's obviously that communication is very patient-centered, and the patient-centeredness, right, it's really evidenced by the way in which health information is obtained or elicited in medical settings, right, and typically being done through the patient interview, right? So the interview format is typically discourse based. It's a discourse based interaction, right? So if we think about it in those terms, it is natural to then assume that consecutive would be the default mode. However, right, this is only true in healthcare encounters where the medical interview is used to elicit information from a patient. And it often assumes, right, that the patient is an active participant, or that the patient is always an active participant in the interaction and the decision making and in the decision making process, right? So it's as such, right, this might suggest, and perhaps this is also something that might perpetuate the existing belief that a lot of practitioners or perhaps researchers and even educators might hold, right, that or that exists, right, that healthcare communication is in fact dialogic, right, and that would explain why we continue to think about the consecutive mode of interpreting as the default mode and it's favored over others, right? So the ideas, right, around the communication triad, as a lot of those who are in this profession understand, as the patient interpreter provider. And it's often based on this notion, right, that healthcare interpreting only involves three adults or three adult stakeholders who know, understand, and accept the rules of communication of their receptive speech communities, right? And that the turn-taking norms, or sorry, rules are always respected. And it implies that all parties, right, understand turn-taking and that the interpreter is skilled in communication flow management, right? So a lot of these, there's a lot of sort of implied and there's a lot of expectation attached to this particular model, the triad that we have, patient, provider, interpreter. However, right, this does not really account for interaction that involve more than three participants, right? And there can often be more than three participants in the room, and this depends on the type of organization, the type of hospital perhaps, or the healthcare setting itself, right, and the purpose of the encounter. So there's a lot of different factors. There might be children, caretakers, or other adults, right? There might be adults of pediatric patients who are also in the room, and the patient might speak English, right? So there might be multiple caretakers in the room at once, and there might also be other there also might be other, right, members of the care team who are present in that particular encounter, right? So monolingual transfer model or the simultaneous interpreting model might be appropriate or even necessary, right? So moving forward in this with this assumption, right, isn't really um, uh, the only option, right, available to us. And there are other factors that we consider. And some of you might say, like, well, of course, that does happen. And consecutive still is, as you will see, right, the one that might be more frequently utilized. But again, we have to consider the communicative purpose. We have to consider the nature of the appointment. We have to consider the structure, the organizational structure, and the purpose, right? It might be an educational or a university hospital, right? A teaching hospital where there might be multiple players involved. And there's also family members, adults, caretakers, and those who also are participating, and sometimes the ones actually making the decisions about the care as opposed to the patient, that we often assume is the one in that patient provider interpreter interaction. Now, the widely held belief, right, within the healthcare interpreting community then is that simultaneous interpreting in healthcare settings and its use are typically reserved for emergency situations only, or they're used in some mental health appointments or for some mental health appointments and in pediatrics. Nevertheless, right, this technique or mode of interpreting is employed in a variety of medical settings and situations outside of the emergency use or the settings that we typically associate or the literature has presented to uh, those who are training interpreters, interpreters themselves, and scholars, right, as the primary modes, and we have been focusing on those as the modes when we need to use it. Now, the literature on simultaneous interpreting, right, a little bit of background, right, is extant, and there is a lot of topics in simultaneous interpreting that include corpus-based studies on interpreting interpreter performance, right, the complexity and the difficulty of simultaneous interpreting mode. There's a lot of research on working memory, syntax, right, word order. There's a lot of research on interpreting errors, additions, omissions, right, when using this particular mode of interpreting. And, it is a cognitively demanding task, and it has been studied also from the perspective of cognition with a cognitive theory, right, introduced by several scholars and conceptualized, right, as a set of efforts by Gilles, right? So, of course, these efforts apply in other settings as well, but it has been studied, and oftentimes it's been studied, and the research has been really sort of focused, or at least it's been centering around simultaneous interpreting in conference settings, right? So the setting itself is very different. It's this very unidirectional transfer. So there's a lot of research, and there's a large body of research on this particular mode or technique, right? Now, other scholars have also focused on simultaneous interpreting quality, right? And some have looked at it as sort of its effect on the delivery speed, right? So thinking about the quality itself and the speed and how those two interact. There are studies on the impact of speed and simultaneous interpreting, and some who also wanted to see sort of how interpreters might handle delivery speed if they adopted any specific strategies to effectively manage that, right? And how that plays out in an actual interaction, right? So there are numerous studies, right, that have focused on that. Now, thinking about sort of in healthcare context, the sheer number of subspecialties and specialties, right, would inevitably lead to a number of new and unpredictable topics and conversations, right, regardless of the communicative event, right, and therefore we could argue, right, or it could be argued that the effect on the interpreter's production effort, namely accuracy resulting from unfamiliar topics, is an important consideration to consider, or in consideration, sorry, in all interpreter-mediated interaction, but especially, right, if we think about some of those instances where familiarity and also ability or having that skill kind of need to go hand in hand. So there's the familiarity, understanding of the context and content, and also being able to perform, right, in some of these high pressure situations that we have associated with simultaneous interpreting in research and education. Now, obviously, some scholars have argued and supported the idea also that the interpreting mode or technique is really only a tool to achieve the communicative goal. And this is especially true when it comes to negotiating which interpreting mode to use during an interpreted event, right? Consecutive or simultaneous. And it is important, right, as some have argued, to use the one that allows you to, of course, to allow the participants, right, to sort of have the most effective way to communicate with one another. And it's also a matter of which one of these modes and the interpreter's ability to use that particular mode will yield the most accurate results. So all of these, of course, are very important. And now, in line with that, also others have argued that, really the mode itself or the technique is a means to an end, right? Which again, is also an important consideration when it comes to skill and ability and emphasis on simultaneous in education or educating and training healthcare interpreters in the first place. Now, if we look at the actual healthcare interpreting research, there really isn't much in terms of simultaneous interpreting in these particular settings. And some studies have come out recently where there, some providers are maybe even testing out simultaneous uh, like transmitters, right? And having a headset and being able to pass it around and having the parents, for example, participate in this one study and follow along with the session that is taking place or this particular encounter that is taking place, right? Instead of using this dialogic approach because it isn't always suitable, right? Due to the number of participants and participants that may speak or may not speak the language of the provider or the language of service. Now, one critical perspective, right, in understanding simultaneous interpreting and healthcare interpreting in the US at least, its significance or lack thereof, right? It's sort of looking at it through the lens of two main, even our certifying bodies, right? And it's an important consideration since, of course, this is one of the requirements for the oral portion of the exam. And this, in some we can look at it, right, as sort of being conflicting in a way, as one may argue that obviously it is used, and from the job task analysis that have been conducted, right, it shows that obviously interpreters do use simultaneous interpreting when they during their weekly or right daily encounters. The percentages of course vary, but it is also an important consideration because it is being studied, right? Or we have begun to study it. We're also looking at simultaneous and its use and trying to understand how does that then, how do we use this data to help prepare and train interpreters? So we are also here to help support this initiative, right? With this particular project. Now, simultaneous in community and healthcare contexts, right? As I said, there are some studies being done and there are some workshops, and some of you may have seen or participated, right? Especially in the US, that we are seeing more workshops in simultaneous interpreting and the studies. And it's been typically discussed, and when it is present in the literature, it's always or usually, right, talked about in terms of chuchotage or whispered interpreting, right, that you are typically using that particular form, right, of simultaneous interpreting and having interpreting, whether it's doing during aged care counseling, family conferences, or any sort of insurance meetings, medical consultations, and in mental health settings, right, when there is a participant who may not be or prefers to speak in their first language or language that they are more comfortable speaking and expressing themselves in, as opposed to the language of service, right? So as I said, right, there's the study that I was mentioning earlier, right? There is a study that was conducted. It was on the child hospital consumer assessment for health providers and systems, and they used a Spanish equipment assisted simultaneous medical interpretation, and this consisted of a noise canceling microphone, an interpreter wore the microphone, and the transmitter and the receiver and the earpiece that the family and the patient wore. And they really wanted to kind of see the responses from Spanish speaking families prior to and following the implementation of this particular technology. And they conducted surveys with medical professionals and did follow-ups, semi-structured interviews with the families. And the findings were statistically significant with both the Spanish-speaking families and the members of care teams, right, demonstrating satisfaction. So they really wanted to look at the patient satisfaction. And the experience scores were comparable to those of their English-speaking counterparts, right? So when I mentioned earlier, right, in terms of sort of the barriers that we face when we conduct research in healthcare settings, right? Some of those have to do really with language access, and some of you who work with language access, they have to do sort of with sort of this perceived, or it's the care benefits, right? So in this case, we are seeing sort of they're studying the care benefits and they're looking at outcomes, they're looking at patient satisfaction and the experience scores, right? So these obviously are considerations for us because the perceived benefits are often what is looked at first in terms of even our ability to conduct studies in these particular spaces, hence why we are often seeing sort of limited number of articles or scholarly work or research, right, that is being conducted in some of these settings. Now, in terms of, pardon me, the study itself, right? So thinking back, like, so why did we, the background and all of the research that's being done. So, what was the purpose of the study? And in order to examine simultaneous interpreting in healthcare, right, we really wanted to look at the US context, and we wanted to, try to answer some of these questions, or begin to answer some of these questions, looking at, using a mixed methods approach and a survey, right, to as the main data collection instrument. We wanted to explore the frequency of simultaneous interpreting encounters in healthcare settings, the nature of appointments or these interpreted events, which mode of interpreting might be called for, whether it's negotiated or chosen by the interpreter, and which one is utilized in the end. And the findings that I will be sharing today, we received over 827 participants took the survey, 662 actually completed the survey. So we had a really large showing in this particular study. And, they were professional healthcare interpreters working in the United States. And they, the criteria was that they will have worked in the last year, or at least have a year of interpreting experience, and have used the simultaneous interpreting techniques or mode during at least one or a series of clinical and or non-clinical encounters in healthcare settings. So we explored the frequency and nature of medical encounters, and sought to answer these questions, right? So the main goal really was to gather information to address some of these questions that are posed often, right, by the community of practice, but really also to help bring the question of simultaneous interpreting in US healthcare context, and the requisite skill development to the forefront, right? So we are trying to sort of bring this conversation up, and hopefully make it part of our research, scholarship, but also really education and training, and emphasize the significance and the importance of this skill, and not something that, we only use in extreme, or under, extreme circumstances, or when absolutely needed. Right? So the study explored these questions. So we wanted to know the frequency, how the mode is determined, and then, the nature of the situation, type of medical interaction or encounter during which this mode is used. Now, there's a fourth question also, that is currently the manuscript under preparation, and exploring the interpreter education and training in the simultaneous uh, technique, and as well as their comfort level, right, with this particular mode. So that is sort of the if you will, version 2.0, or I guess that would be updating the current study, but that is the sequel of this particular study that will be coming out. Now, so how do we then, or how do interpreters, to help answer this question, right? How do interpreters decide which mode or technique to use? We pose the question, right? So how does the mode determined, or how do they actually decide which technique to use? And out of a total of 637 responses that were recorded, right? There were 261 that said it was based on the nature of appointment, right? Uh, they were those who said that it was negotiated with a provider, about 10, and then there were those who said it was both nature of the appointment and negotiated with the provider, and those who claimed other, and then they were given the option to offer their specific examples. So we had nature of the appointment, negotiated with a provider or with the providers, and both nature of the appointment and negotiated with the provider, and then other. So for those who said other, the participants shared that, some of those had to do with nature and modality, right? So it was in person versus remote. Some that negotiated with both provider and patient, of course, in addition to determining the modality itself. Some said that it was based on preference. So the mode was determined based on the provider's or the patient's or the participant's preference, right? And this was really in specific to, some of the examples are specific to American Sign Language or ASL, where, language preference and ability, right, were also taken into account. Some also shared that it was interpreter choice. Again, also decision dictated by the session, and sometimes changing, right, as the session went on, changing the mode or technique. And then we also had some that said that it was also based on the participant number, participant and our spatial configuration, right, room layout. So kind of taking that into account, positioning, right, trying to also navigate some of the actual sort of configuration or spatial challenges in order to be able to effectively communicate the information that was being shared. Others also shared, that sometimes when there are side conversations with other language concordant individuals in the room, that they would then switch or update the mode that they were using. Speed or lack of, right? If there's frequent pausing, for example, or lack of pausing. And then some said that they actually just decided in the moment. It was very spontaneous, sort of assessing the situation, right? So kind of thinking back to what I said at the beginning, that really any interpreting, but healthcare interpreting, it's a series of decisions, right, that are being made, whether, you're making them consciously or subconsciously, or some are just made without thinking, right? Or sort of they're not anticipated, right? Or they're not really planned, right? But these are made in the moment, and you manage, right? So it shows agility and shows that sort of quick thinking that is required by interpreters in healthcare settings, or really settings that sometimes might be, high stakes or stressful, or high stress, or high pressure situations. Others shared in situations or emotions of emotional distress. Some shared also that, they would determine the mode based on the patient's cognitive deficit, or if there's a patient or cognitive abilities, and sometimes, if there is any sort of injury or brain injury. Others share that it's prior knowledge and experience with the patient and provider, and their preference, right? So also, if there is any continuity of service, right, you already know what the patient and the provider preferences are, and you're able to then determine this mode prior to even entering the session. You already know what the expectations are, right? And some also shared switching to simultaneous if consecutive is not working or not suitable for the session. Dynamics of the appointment, right? So dynamics change, modes or techniques are updated accordingly as well. Others shared, pediatrics and what we've seen. And also there's a little bit of overlap, as you'll see, the frequency determining the mode and sort of the nature of appointment itself, right? So how is it determined? They were given these options, and then the nature of appointment, we'll go into more detail, right? So when we talk about the frequency and the nature of these appointments that where simultaneous is used. And others shared also, that sometimes it's a default mode. And, one person said, I'm a sign language interpreter. We almost always work with simultaneously. Others also, both signed and spoken language interpreters offered additional responses, and shared examples, like, for example, one interpreter of American Sign Language shared that with ASL, the order of operations would determine the fit, right? Assuming the patient is conscious and non-emergent. So the first thing is the client language preference. Number two is situation, right? Number three, provider input, right? Because in the deaf community, there are two major forms of communication used, with one being a true language, ASL, and the other a language code, SC. And we can't know how to sign until we see which form they use. And if it's the latter, there are also subcodes of that form, right? So with ASL, you must sign consecutively. With the codes, you must sign simultaneously. So the consumer language preference in this case determines the mode, right? Another sign language interpreter shared also that deaf people have varying degrees of fluency in their own language due to a number of factors, and language deprivation is an issue in the deaf community. So the deaf person's ability to use ASL is the biggest factor on whether or not I can work simultaneously or not. And the last example I'll share with you in terms of determining the mode from a spoken language interpreter, they state that, I assess the ability of both the patient and provider to successfully maintain meaningful and efficient communication as I use the simultaneous method, of interpretation, and I perform a very short pre-session, mostly with the patient, as most physicians seem to be used to simultaneous methods, pardon me. If any of the parties display distress with simultaneous, then I switch to consecutive. So as you can see, there's a lot of, again, decision making, and how the mode is determined really depends on this particular initial sort of assessment, right? And a short interaction engagement, and also preferences. But there's a lot of decision making that goes into how this mode is determined. And for those who are in this profession, and for those of you who are educators and who are familiar with the code of ethics, right, you probably are nodding your heads, but it is in the code of ethics that the interpreter determines the mode that is the best appropriate, the one appropriate for that particular session. Now, now we're gonna sort of shift gears, right? Talk about the frequency of use and the nature of the encounter. And I don't think this is going to come as a surprise to you at all in terms of the frequency of use, right? The results, of course, show that professional healthcare interpreters do, in fact, employ the simultaneous interpreting mode, despite the anecdotal evidence to the contrary sometimes, right? Because there are those that will claim that it's not appropriate and never it should never be used in healthcare settings. So to the evidence to the contrary, right, or to the limited emphasis on this particular mode in this specific context, in the community of practice, right? It is used despite what we have seen and the limited research that we have at our disposal, right? But more is coming out, and hopefully more will continue to come out to support not just the frequency of use, but also the nature of encounters, and then we can use that to help guide us moving forward, right? So what our study showed, right, is that about 10% or about 70% of our participants out of the 638 who answered this particular question, they perform SI in about 75 to 100% of healthcare encounters. We had about 378 participants, or about 59%, share that they were within the 0 to 25% range. Now, I think one of the limitations of this study in particular, we wanted to make the ranges a little bit bigger, but I think, we would have been better able to gauge, right, that had we made the ranges smaller. But about 59% of participants, right? So it's the larger percentage of our participant, or they use the simultaneous with less frequency, but still it's a significant number, right, in terms of the percentage itself, when we look at it that way. And then furthermore, right, there were those who also fell within the 25 to 50% range. It was about 136 participants who, or 21% who were within the 25 to 50% range in terms of the frequency of use during encounters. And then there were about 8% of those who use simultaneous interpreting, and 50 to 75% of their interpreting encounters, right? So our really what we hope to do is, by shining a light on the wide range and the frequency of SIUs, is to demonstrate that this technique, of course, is present in professional practice. Now, in terms of the frequency of use, although we focused on simultaneous interpreting, we really also found that, as expected, that the majority of our interpreters will use consecutive interpreting with greater frequency, right? And then sight interpretation, or that particular technique, was used with even less frequency, or less frequently than simultaneous interpreting, right? So I think that really goes to show that there is some truth to consecutive being used with more frequency, and there is truth to that. However, right, it still isn't true that it is the default mode or the only mode that is used in these particular settings. That simultaneous, in fact, is used, and we need to, the more we understand, right, the better understand where it's used and the nature of these encounters, the better prepared our interpreters going into the profession can be, and the more we can do with that data. So in helping further demystify simultaneous interpreting in healthcare, right, and sort of changing the perceptions of healthcare interpreters around this technique and when it's used or when it should be used, I will share here briefly some of the situations, or the main categories that we provided our participants, our interpreters, and 662 of them answered, right, to the question of in what situations do you use a simultaneous interpreting mode. They shared, that it was in these particular categories, right? So the choices that we offered them, or these categories, are here because we wanted to base these on existing limited literature and the anecdotal evidence, or of where healthcare interpreters might typically employ this particular technique, right? So of those who answered the questions, or if you look at the chart itself, right, some of them said that it was their default mode, some said it was in emergency situations, right, about 62%. And then when the person accompanying the patient doesn't speak English, it was about 35%. When interpreting for parents or adults of English-speaking children, it was about 50% of those who answer that. And then when it gets hard to keep up with using consecutive, right, we had about also 51% of individuals who responded, that this is also, just to also clarify, right, they were able to select multiple options here. So if you look at that, it was kind of split down the middle. And then we had some participants who shared other, but it's really in It's interesting, of course, to see, right, that it's the emergency situations that when the person doesn't speak English or person accompanying doesn't speak the language of service, and when interpreting for parents or other adults accompanying the patient, and when it's hard to keep up, right? So again, kind of really, it further, I think, cements our, if you will, even reason behind why we wanted to do the study, but the need to emphasize simultaneous interpreting even further in education, because if it becomes hard to keep up with consecutive, you have to be ready to switch and you have to be able to use this particular skill. Now, of those who said other, right, I'll elaborate a little bit and share some of those examples because I wanted to offer them to you. So, because I think it's really in the 121 participants who answered other, or 113 that provided additional information and more details for beyond emergency settings, right? So settings outside of emergency use for simultaneous interpreting, those particular departments shared, and settings that they shared are many, right? So I will share those and just kind of it's sort of broad strokes, but really offering also some specific examples so you can see just the sheer, of course, healthcare specialties are many subspecialties and there's a lot of information, but even just in these answers, it was really telling where most of these happen. Some, of course, confirm that it is, in fact, in the settings that we see as anecdotally and also in literature as the ones that we emphasize. However, beyond that, there are many more. So one of the first settings, right, is in pediatrics. So if you look at this particular setting, there's here's an example as well, right, for somebody sharing how that might look like or what that might look like, right, when maybe there's an iPad that headphones are plugged into and that's provided for the parents or those accompanying the child who might speak the language of service, right, to then follow along. And nobody needs to pause, and it helps the session goes smoother, and it helps the parents still, they're not maybe always, right, providing information or making decisions, right? They're being informed. In this case, they're receiving that information and interpretation is taking place using this particular mode, right? So there's behavioral health, developmental behavioral pediatrics, or when children don't understand turn taking, sometimes it's also a very useful mode to switch to. In educational seminars and presentations, among the examples provided here, there's also pain management, right? Nutrition, diabetes, lactation, any of those settings, right, where education is taking place, seminars and presentations or educational sessions on chemical dependency, transplant teaching, examples included bone marrow, organ, kidney, right? Different informational sessions, post-operative techniques, education and seminars and presentations on the psychology of pain, anxiety and stress management, vocational classes, right? Some for brain injury or patients with brain injury, training for life after a stroke, right? Mother-baby classes. So a lot of different topics, a lot of different sessions, right? And types of educational seminars and presentations in which this particular mode is used. Others shared family care conferences, right, end of life or palliative care conversations, right, during palliative care meetings when there are multiple family members, when there are multiple family members, right, everyone's feeling anxious, trying to speak at the same time, right, even though the interpreter might constantly be reminding them to speak one at a time and take turns, right, sometimes it's really not the right time to be making those types of suggestions or interruptions, right? So simultaneous might be the mode to just best support that. Behavioral health, right? So that supports, right, the mental health settings and that kind of evidence that we've seen in the past. Psychological evaluations, right? When the patient's in crisis, involuntary hearings. There is also dissociative disorders, autism spectrum, right? Different mental health and different psychiatric or psychotherapy assignments. Therapy and rehab, right? Whether it's group therapy, functional rehabilitation programs, or physical therapy and uh, rehabilitation, right? So all of these different, whether it's a support group for addiction, whether it's cognitive behavioral therapy, drug rehab, functional restoration rehab, all of these settings are the ones that have been cited, right, as settings where SI or simultaneous interpreting is often used. Right. And during rounds, and typically during rounds, right, there is also somebody presenting, there's a lot of information, sometimes very technical, right? And it's often one or more parties in the room, and they do not speak the same language, or not everybody speaks both languages, the service language, or language of the service seeker, or the preferred language of the service seeker. Trauma settings also, right? So we're seeing sexual abuse as an example, when the patient is agitated or highly emotional, right? So some support the existing, right, studies and anecdotal evidence, and some also are indicative of additional examples or settings where it might be appropriate. And here are additional examples that we've collected, and many that are categorized right in the actual article, but I wanted to include them here just because, again, there are many very specific examples. If you're communicating commands, right, if you're working with elderly patients, when it's appropriate and patient and the providers are comfortable with the method, hospitals communicating with non-English speaking staff, workers' compensation in the ICU or intensive care unit, when patient and provider don't pause, sorry, allowing the interpreter to interpret when providers, pardon me, have conversations or consultations with other providers in the room, right, or specialists in front of the patient, when it's fast paced, when time is limited, right, a lot of information is being shared at once. Now, there's, of course, some of these might be problematic, and you're like, wait a minute, that's when it's particularly important, of course, to get it interpreted accurately and completely, and for everyone to understand all that information, right? So speed is, could raise a red flag here. And then, when there is a team of healthcare professionals in the room, again, kind of goes along with what I was saying earlier, right? And some additional examples, again, when patient is describing symptoms and pointing, when providers pointing at different things or explaining concepts, and some shared simultaneous, right? When speakers have natural pauses in their speech. So then, it might be also something that you do to kind of compensate for that, to not lose the flow of conversation. If you're interpreting for a person who's not part of the conversation, again, it kind of goes along with when there's multiple speakers in the room and you want everybody to be present linguistically, right, to know what's going on. And remote sessions, if there's a dedicated or designated channel, and when patient switches between languages. And some other examples, right? If the goals are clear, as we saw, and there's an understanding that this is the mode used, it's agreed upon for certain follow-ups, and then during qualified medical exams is another one that was shared, and, what the questions are answered beforehand. So that brings us here to this next step, which is thinking about, we've sort of established and saw in these findings that simultaneous interpreting is in fact used in healthcare settings beyond emergency situations, beyond mental health settings. It is used beyond pediatrics, right? But really, and of course those were also confirmed, but we saw that there were very specific and very nuanced responses that allow us to, right, examine then, some of the opportunities, or look forward to implementing and thinking about simultaneous interpreting in healthcare interpreter education and training, right? And finding a way to emphasize it as a skill, right? And kind of slowly start to change the narrative that consecutive is the default mode, and what that might look like. So thinking about opportunities for simultaneous interpreting in healthcare settings. And right, of course, not all trainings are created, and educational opportunities are created equal. Some are, sort of non-academic, some are academic. So depending on the program structure, resources, all of those things, whether they're language specific, non-language specific, whether the interpreter in healthcare, interpreter education has additional training prior to that, right? So all of these factors are a part of that, and they need to be taken into account, right? But there are opportunities that can be created, and hopefully using some of this data, we can think forward or look forward to and look ahead, to implement, right, and really emphasize skill development and simultaneous as something that interpreters need to have not only developed as a skill, but also maintained and improved and honed, right, over time as they continue their practice in this particular profession, right? And I want to conclude with this particular quote, right? So a lot of the perhaps reasoning, and I think some might say that simultaneous interpreting is maybe easier for them because perhaps they have conference interpreter training and they're working in healthcare settings. But one of the most striking and challenging phenomena in simultaneous interpreting is the interpreter's persistent perception that it is fundamentally difficult, according to Gilles, right? And others, and Russell argues that interpreting whether simultaneous or consecutive, it is a highly complex discourse interchange where language perception, comprehension, translation, and production operations are carried out virtually in parallel, right? In addition, when the interpretation is delivered simultaneously, it is performed under severe time pressure. So the reason I wanted to share this quote is that it is perhaps what might help explain why sometimes there is a little hesitation around, or perhaps some of the perceptions around simultaneous interpreting among healthcare interpreters, but also to kind of help us use this as the point of departure as we look into development of this skill or continued development of this skill, and emphasizing this particular skill as important, and thinking about, right, as some of the scholars have stated, right, sort of the time pressure, and thinking about emergency situations when accuracy, right, and the ability to do interpreting using this particular technique is particularly important. So I will end on that note and leave you with a few select references, which I'm happy to share a full list if anybody is interested, or you can hopefully, I invite you to read the manuscript when it's published next spring, but I'm happy to share additional information. And I thank you for listening to today's, I don't want to say show, today's webinar, to today's presentation, and I invite you to ask questions, and I open the floor to you now.